I'm AJ. I'm a behavioral health therapist at Equitas Health in the Mental Health and Recovery Services Department, and I help run a program called CAP IT, which it's a quarter program for perpetrators of domestic violence. It has a psychoeducation portion as well as a processing portion.
And my name is Sarah Tubell. I am a licensed social worker. I am one of our behavioral health prevention specialists, and I do individual counseling as well as run our Power of Change support group. Is for people who have experienced intimate partner violence and are part of the LGBT community.
Perfect. So we'll go ahead and jump into some myths and facts about domestic violence. So today we're going to talk about kind of a lot of different myths and facts, as well as the power and control wheel and what different aspects of domestic violence could look like. So one of the first myths that we have is that domestic violence is always intentional. One of the things we know about domestic violence is actually some of it can be very without intent. So for example, there's a lot of vulnerabilities that could come about that make a behavior more likely to happen. So for example, one vulnerability could be if someone drank a lot and then they had a domestic violence event, maybe it's something they would do while they're sober, but it's still a domestic violence event and it still impacts the survivor a lot and even the perpetrator. So we know that that can be a really big factor.
Mm-hmm. Another myth is that domestic violence is a straight person's problem. And a lot of literature and most of the research done on domestic violence has been based on heterosexual relationships. But in reality, domestic violence actually occurs in LGBT relationships at similar rates and even higher rates based on some studies.
We also know that there's another myth that it only impacts survivors of domestic violence, that domestic violence only impacts the survivors. That's a total myth. We know there's a lot of folks that could potentially be surrounding the events that could be impacted as well. So that could be, for example, children who are witnessing it, even people who are outside of the home not witnessing it. For example, friends, because there can be some isolation that happens from the domestic violence perpetrator, for example, to the survivor and that kind of stuff, which we'll get more into when we get into the power and control wheel.
Another myth is that domestic violence is only physical violence, and that is not true. Domestic violence can be sexual, it can be emotional, psychological, financial, and there are a lot of other ways that people can use violence other than physical. And we will talk about this more and go into more specifics of what some of those things might look like.
Mm-hmm. So another myth is that the masculine partner is typically the abuser. So regardless of gender, expression, or identity, domestic violence happens across the board. So there's a lot of research in general that kind of Sarah was mentioning, that's very heteronormative. And so I think there's a tendency to look at things from one specific perspective and not have enough research on other perspectives as well. We also know that people are less likely to intervene when the abuser is more feminine presenting, versus if it's more of a male presenting person towards a female presenting person. Obviously, there's not a lot of research on LGBT and people on this on the spectrum of gender in terms of domestic violence frequency or things like that. That's something that needs to be kind of developed over time.
And one of the last myths that we have today is that it is easy to leave a domestic violence relationship. So for a lot of people who might have never been in a domestic violence relationship, there's a lack of understanding of why it is so difficult. And a lot of that is why, is the psychological component to the violence that kind of keeps people in the relationship. There's also a big safety component. So often people really need to plan and work out how they're going to leave, how they're going to support themselves on their own in a way that is safe for them to do so. Usually violence increases around the time someone tries to leave the relationship. Good.
Yeah.
Yeah. So now we're going to go into our power and control wheel. So the power and control wheel is often used to help talk about domestic violence relationships. There is one that we will be using that is specific to the LGBT community. And the center of the power and control wheel is power and control. And so it's kind of a representation of what's at the center of domestic violence relationships. At the outer rings of the circle are physical violence, sexual violence, as well as homophobia, biphobia, transphobia, and heterosexism. What we will actually be talking about is the pieces of pie that kind of make up the circle, and the other ways that people might experience or experience the power and control used against them in their relationship. So the first piece of that pie that we will be talking about is using coercion and threats. So coercion and threats are often used or made to do something to harm you. They're meant to create fear in a situation. So they might threaten to commit suicide is a very common one, or threaten to leave the relationship. They might drive recklessly to frighten you, and threatening to out you maybe to others, threatening others also who are important to you. So they might threaten family members, or say that they're going to hurt your family if you leave them. This is also where stalking comes into relationships a lot of times, is through the coercion and threats.
So another thing that can be used a lot of times in domestic violence is using intimidation. So again, this goes back to that power and control idea. This is another way to try and kind of maintain power and control. So this may be like making you afraid by using looks, gestures, or actions, right? It could be like smashing things. So for example, like even throwing like a wine glass at next to somebody, right? Maybe not hitting them, but that's a threat, right? That's intimidation. Um, Abusing pets, that can be a really scary thing to watch. Displaying weapons, so like having something out on the counter while you're having a really intense conversation, or like pointing to something that's a weapon or things like that could be an example. Also using like looks, actions, and gestures to reinforce homophobic, biphobic, or transphobic control. So this can also kind of tie into the coercion and threats, like kind of outing people or threatening to out people, can also be a form of intimidation.
And then the next piece of it is using emotional abuse. Sometimes people might call this verbal abuse, but this mostly looks like putting you down, maybe calling you names, making you feel bad about yourself, playing mind games with you, making you feel guilty, humiliating you in front of others, questioning how real you are. Like, are you a real woman, a real man? And kind of reinforcing that internalized homophobia, biphobia, or transphobia. That it can take like a real emotional toll on somebody being constantly put down and name called in that way.
Yeah, so jumping back and forward at the same time, we're going to be talking about using isolation. So previously, we had talked about how one of the myths was that domestic violence only impacts survivors, right? We know that's not true based on the myth we introduced earlier. So using isolation is one of those ways that others begin to become impacted. So for example, like if the survivor is isolated from friends, not allowed to see them, or only allowed to see certain people, only at certain times, those are all ways that this could be brought in. So other ways that isolation could be brought in is controlling what you do, who you see, talk to, limiting your outside activities, so like not being allowed to go do hobbies or like even go to the store by yourself, making you account for your whereabouts, like kind of excessively, not just like, hey, you're like really, really late, where are you? Are you okay? But consistently checking, right? Saying no one will believe you, especially like for whatever reason, right? No one's going to believe you that I abuse you or that this is going on or anything like that can definitely be a factor there. And sometimes with some of the transphobia and the biphobia and homophobia we've been talking about, There are times that can be used as a reason why people may like not believe them. So yeah, also like not letting you go anywhere alone is a big one.
Mm-hmm. And a lot of times survivors, have a lot of self-blame for the relationship and the things that have happened in the relationship. And this is often a result of the perpetrator using, denying, and minimizing or blaming. So kind of just making light of the abuse, saying it didn't happen or that the person is crazy, shifting blame or responsibility for abusive behavior, saying it's your fault or you might have deserved it, or accusing you of abuse as well. Saying things like women can't abuse women or men can't abuse men, or maybe it's not fighting, or it is just fighting, it's not abuse.
Mhm. So jumping off of that a little bit, um, and kind of talking more about impacts on others as well, is using children. So there may not always be children's situation, but when there are, a lot of things can kind of be done or used in domestic violence. So one of the things is making you feel guilty about the children, like about the things that are going on. So for example, maybe blaming you for like if you're the survivor, for not protecting the children or whatever it may be, or not doing the right things or any kind of thing like that. Using the children to relay messages, especially for like adult conversations. This can be really detrimental to the kids. There's a study called Adverse Childhood Experiences, and there are like domestic violence is one of those things that absolutely can be an ACE, an adverse childhood experience, which is likely to lead to more complications down the road, right? So we know that getting them more involved kind of creates these sort of barriers as well as issues. So another thing could be threatening to take the children, threatening to tell your ex-spouse or authorities, kind of like outing you to people is another thing. So those are some examples of like how children could be used somewhat as pawns in the situation.
Mhm. Um, and privilege can also be used in domestic violence relationships. So depending on the privilege that someone in the relationship might have, they might treat you like a servant or make you abide by certain gender roles. Maybe they'll make all the decisions in the relationship and you don't have a say. They might use the ability to pass to discredit you or put you in danger. Um, they might cut off your access to resources or use the system against you, maybe cutting off your resources, such as with job and family services or children's services. They might cut, they use isolation as well, and a lot of times that is our access to resources.
Mhm. So one of the last things we're going to go over is something that a lot of folks don't really think about. And when we think about domestic violence, it's economic abuse or financial abuse. So there's a lot of ways this can come into play. So a couple of those are preventing you from getting a job or keeping a job. So potentially like trying to get you fired or sabotaging your likelihood of getting hired, as well as like not allowing you to go to work or things like that. So also making you ask for money. So them controlling the money and not allowing you to have any independence over your own can be a really big thing, or over the joint money. Keeping you off of joint assets is also kind of a form of financial abuse. Using credit cards without your permission, interfering with your work or education, not working, and requiring you to provide support, then keeping your name off joint assets as well. So these are all things that really tie in to domestic violence, and these are all different ways that it can be brought in that we may not think about generally.
Mhm. Yeah, so that's all that we have today. Thanks for joining us, and I hope you learned a little bit about maybe past relationships or current relationships. We definitely recommend therapy if you have some current concerns about your relationships and need to talk to somebody. Thanks. Bye.